I really honed in on the holistic approach of medicine. That's why I pursued osteopathic medicine. And family practice, you get to care for the patient, right off the door, and often multiple family members. So I feel like you have more of a effect on people, and that's why I pursued family practice. Ideally, I'd like to make sure I understand the entire medical history, kind of the whole, picture of the patient, what their medical conditions are, what their care goals are. And that's very important to me because it heavily weighs on the decision that you make to treat the patient if you understand what their care goals are. When I first started at the clinic, that was about 1.5 years ago, I had a very nice lady come in with metastatic breast cancer. And we had a conversation kind of like we're having right now, and she told me, look, I want you to understand, I am not getting chemotherapy. I am not doing anything aggressive at this point. I believe in quality of life, and that is how I'm going to live. About 1.5 years later, and I've seen her, pretty frequently up to that point, she came in unable to breathe, which I kind of had a sinking feeling that her cancer had progressed, and an x-ray confirmed that. But her main concern, her first great-grandchild was born that day, and that's all she wanted to do was go hold her great-grandchild. So as long as she didn't move, her oxygen levels remained relatively stable. So I called her daughter, had her daughter come in. We were able to give them a wheelchair and transport her to her granddaughter's house so she could hold the baby for the first time. So that I think is a primary example of how I practice medicine. So I try to listen to my patients. I try to adhere by their care goals as long as it's, appropriate. I truly believe patients are advocates for their own health care, and that's why, listening and having a discussion is so important in the beginning. So those are kind of like the main cornerstones of how I practice.